This is Charlie. Charlie is currently 48 years old, and his occupation is a lawyer. This is Charlie's family. To his right is his beautiful wife, Marcia. Next to her is his daughter, Callie, who is currently a student at the University of Kentucky studying pre-pharmacy. And to her right is his son, Charleston. He is in elementary school and currently is on the basketball team. Each summer, Charlie and his family travel to the beach after the children are out of school, but this year, the outcome of the trip was completely unexpected. On day 3, Charlie became very ill. One minute, him and his family were sitting down having dinner, and the next, he was rushing to the bathroom because he felt sick. From there, Charlie was immediately rushed to the local hospital where he was treated based on the diagnosis of kidney stones. From there, Charlie and his family decided that it was time to go back to Kentucky. In Kentucky, Charlie visited many different hospitals. He visited many different doctors to obtain different opinions regarding his illness, and he also took many forms of medication. After undergoing several tests and labs, Charlie was diagnosed with a poorly differentiated neuroendocrine tumor of the rectum with metastases to the colon, hip, shoulder, lumbar spine, and lymph nodes. Tumors grow in the body just like any cell. Eventually, the cells will need a stable source of oxygen and blood. This can happen through a process known as angiogenesis. The tumor sends signals known as growth factors which tell the body to form new blood vessels. VEGF is an important growth factor because it binds on the surface to the surface receptors of cells to stimulate new blood vessels to grow towards the tumor. This is key to survival. The blood vessels are thin, which makes it hard for the anti-cancer drugs to reach the tumor. Charlie's doctor insisted that he take 3 drugs in addition to radiation therapy. Those 3 drugs include Avastin, irinotecan, and Xeloda. Avastin is an anti-VEGF treatment. It binds to VEGF and blocks its actions, which withdraws the existing blood vessels from the tumor and stops new blood vessel growth from happening. The existing blood vessels are able to strengthen and better deliver anti-cancer drugs to the tumor because of this medication. This is why Avastin is taken in combination with chemotherapy. Avastin starves the tumor of blood and oxygen, which makes it harder for the tumor to grow. The second drug, irinotecan, is a medication that is injected intravenously to treat patients with metastatic cancer of the colon. It belongs to a group of cancer medications known as topoisomerase I inhibitors. It works by stopping the growth of cancer cells by manipulating the structure of DNA necessary for replication. The drug is a plant alkaloid, which means it is made from plants. It is cell cycle specific, which means it attacks the cells during various phases of division. Common side effects of this medication include hair loss, diarrhea, pain, fever, and weight loss. The third drug, Xeloda, interferes with the growth of cancer cells and slows their spread in the body. It is used to treat cancer that has spread to other parts of the body. Xeloda is taken orally twice a day with water after eating a complete meal. In the body, Xeloda is transformed into a chemomedicine known as 5-fluorouracil. Once the transformation takes place, it interferes with the cell's ability to make new DNA and causes important parts of the cell to stop functioning. Together, these 2 actions can cause permanent damage to the cell. Cancer cells divide more rapidly than normal healthy cells and are therefore more affected by Xeloda. In addition to these medications, radiation therapy was used. Radiation therapy uses high-energy radiation to kill cancer cells by damaging their DNA. Radiation can damage normal cells as well as cancer cells. Therefore, treatment must be planned carefully to minimize side effects. The radiation used for cancer treatment may come from a machine outside of the body, or it may come from radioactive material placed in the body or near a tumor intravenously. A patient may receive radiation therapy before, during, or after surgery depending on the type of cancer they are treating. Some patients receive radiation therapy alone, and some receive radiation therapy in combination with chemotherapy treatments. Charlie received 18 different treatments of the 3 medications previously discussed, as well as radiation from the machine. Charlie experienced some of the side effects of these medications. Those included hair loss, pain, and weight loss. Charlie was able to experience 6 happy months as he went through this treatment until one day his bowel obstructed. This resulted in a colostomy, which is a surgical procedure in which an opening is formed by drawing the healthy end of the large intestine or colon through an incision in the anterior abdominal wall and suturing it into place. This opening, in conjunction with the attached stoma appliance, provides an alternative channel for feces to leave the body. After the colostomy surgery, Charlie took a turn for the worse. He still continued to take his chemotherapy treatments and radiation, but that just wasn't enough anymore. The cancer had spread to multiple organs in his body, and after 2 short months, Charlie had passed away. There were other treatment options that Charlie could have considered to treat his disease, such as participating in clinical trials or taking medications such as carboplatin and etoposide. One clinical trial that is currently out there that's treating diseases like Charlie's is called DC-Vax Direct. DC-Vax Direct is a personalized immune therapy for inoperable solid tumors because of the spread of multiple tumors. DC-Vax Direct is administered by direct injection into a patient's tumor. DC-Vax Direct is an injection of partially matured dendritic cells that eradicate tumors. The cells have the ability to pick up tumor antigens and the ability to travel to the lymph nodes and immobilize the immune system to attack tumors. This clinical trial is currently being administered at the MD Anderson Cancer Center in Houston, Texas. Another option Charlie could have undergone is taking a drug known as carboplatin. Carboplatin is a tumor-killing drug that is administered intravenously over a 15-minute time period. It induces intra- and inter-strand DNA crosslinks and DNA protein crosslinks, which result in cell death and cell growth inhibition. This drug is very stable and less toxic than other drugs of its kind. Carboplatin is used in combination with other drugs to treat cancer that is spread to multiple regions in the body. Side effects include nausea, mouth sores, hair loss, and weakness. One last treatment option that Charlie could have considered is taking a drug known as etoposide. Etoposide is used in combination with other medication to slow or stop the growth of cancer cells in the body. It is an anti-cancer drug that belongs to the topoisomerase inhibitor drug class. This drug class interrupts the DNA replication in cancer cells. Etoposide is a capsule that is taken orally once a day for 5 consecutive days. The cycle can be repeated every 3 to 4 weeks depending on the body's response to the medication. Side effects of this drug include nausea, vomiting, mouth sores, pale skin, unusual tiredness, hair loss, and dizziness. As you can see, there are many different ways in which a disease such as cancer can be treated. Because of current technology, medications and treatment options are multiplying. Hopefully in the near future we will be able to use our knowledge and resources to find a cure to cancer so people like Charlie can battle cancer and win.